Welcome to everybody who has joined us this afternoon at happy hour on a Monday. We are really excited to be presenting something that we have been working on as a group for about a year now on a topic that we are assuming you also find very important, which is caregiving. All of us, or most of us on this call, all interact with caregivers in the cancer space in some fashion, either as clinicians or with nonprofits that work with caregivers. And so this has been on the forefront of a lot of our minds for a long time. And we want to thank the Tower Research Foundation for giving us a grant in order to be able to put together this educational webinar for how to be a good caregiver mentor. Again, we think this is something that's uber important for my great vocabulary I just used, and really something that is not talked about a lot, and there's really very little literature and documentation to go to help caregivers learn how to be a really good mentor. A panel of experts that is going to talk about the content that we have put together for you. My two other partners for getting this grant are on the call, who's Shannon LaCava, who will introduce herself in a minute, and Marlon Saria. And the rest of my co-writers, a few are missing today. I'm just going to go around the table. We have Pastor Rhonda, Andrea Danner, Jessica Ernest, Shirley Otis Green, Shelley Rosenfeld, Liesl Schweers, and Jennifer Drew, all of which will do a little bit more of their own introductions when they talk about their section. And then as we flip through the slides, Shannon, you can put the slides on if you want. We had a number of other contributing members that really help shape this going forward. So you can advance a little bit. And one more. There's all of our lists, as I mentioned, of all our contributing authors who have joined us today and going to talk about their sections. And if we go one more slide, these are the list of participants that all took part in our monthly brainstorming sessions before we actually wrote our content. So as you can see, we have a wide range of cross-disciplinary and cross-institutional participation all across the greater LA area, which just goes to show how many people really think this topic is important and really want to contribute to having a good educational set of information out there. So without further ado, one more slide. These are the 5 chapters that we have divided up our webinar into that we're going to cover. The first one is going to cover mentorship. Then what does caregiving mean to the individual? Normalizing the cancer experience, cancer facts and lingos, and support and resources. Okay, except we're getting something that says they can't see or hear anything. That's a problem. So I don't want to start until we're ready. Everything is being recorded and is going to be available afterwards. But Larissa, do we know what the issue is?
Melanie, I think you're all set to go.
Okay, fine. Then we're all set to go. So with that, we're going to start off with chapter 1 for mentorship. If you want to put that on.
And Larissa, we have us on record?
Yes, we do. We're all set.
Excellent. So I am going to hand this over here.
Fantastic. So our presenters are going to introduce themselves now and talk about mentorship. Take it away.
Well, Pastor Rhonda will turn on her mic in just a second, but while she's doing that, I'm Shelley Rosenfeld. I'm co-director of the Cancer Legal Resource Center.
And I'm Pastor Rhonda, founder of Celebrate Life Cancer Ministry. All right, so let's get started. So how to be a good caregiver mentor, which is the next slide, please. Okay. So our objective will be to identify the characteristics of cancer caregiver mentor, define mentorship, the mentor's role, modeling communication strategies for caregivers, and establishing boundaries. So how to be a good caregiver mentor? Congratulations, you are already a good caregiver in order to be a good caregiver mentor. You have been through the act of caring for someone, a family member, a friend, or a patient. It is now time for you to be a mentor to another. Your experience as a caregiver can be very valuable to the potential or the current caregiver. Next slide, please. To be a good caregiver mentor means that you help to guide another person through something that you have experienced doing already. In many cases, there's no training session for you. You were tossed into the caregiver role through one or more of these reasons. Either there was an accident, an emergency, or someone was diagnosed with a disease, or someone was simply aging. No matter what the reason, you stepped up to the plate and provided services for someone who needed your assistance. Thank you. So the characteristics of a mentor include being a good listener, to give constructive feedback, to take personal interest of the mentee, be enthusiastic about their role, to treat others with respect. You are already a skilled teacher. Demonstrate responsibility for the employee that they're mentoring. You are non-judgmental. You have the expertise in a certain field. You take pride in their work. And then we also provided a link to a guide with several other characteristics of a mentor.
So let's talk a little bit about being a caregiver mentor and the definition. So a caregiver mentor may be a leader in the community or an experienced caregiver who is respected, trusted, reliable, and demonstrates strong communication. And this really manifests itself as care for their clients or patient. They can be a peer or a family member who can provide moral support and also train other caregivers and evaluate progress and communicate with new caregivers. So an ideal mentor is open to walking alongside a caregiver without necessarily giving advice or getting overly involved and blurring boundaries. Next slide. So a mentor's role involves careful listening. Sometimes people might think that they have to get involved in a direct way, but sometimes the best support that they can provide is being interpreting and the meaning and emotion, and in their communications, let the caregiver know that you're listening, showing empathy, which means essentially letting the caregiver know that you not only understand the words used, but also are sensitive to the feeling expressed. So here's an example. Statements like, "You sound really discouraged," can let the caregiver know that you care about more than the factual content of their message. You care about how they feel. In email and other types of electronic messages, convey that you hear both the content of what was said and the feelings that were expressed. Both very important. Next slide. So the mentor's role, be clear and specific. That is in your questions, requests, and answers. It's a good idea to ask open-ended questions rather than questions that can be answered with a yes or a no. Understand that a caregiver's view of the world may be different from your own, and that everyone is entitled to their own opinions and beliefs. Another important aspect of a mentor's role is to provide guidance that is supportive and positive. Avoid lecturing or passing judgment. Guide caregivers through a problem-solving process rather than provide a solution to their problem. Next slide. A mentor's role. So we'll compare pediatric versus adult. A caregiver of pediatric and adult patients have overlapping needs. A pediatric patient may be more dependent on their caregiver, requiring more caregiver responsibility. The same may be true for caring for an elderly patient. Next slide. So let's for a moment take a look at mentoring the caregiver of a pediatric patient. So recognizing and respecting the unique family culture and traditions that may differ from your own, recognizing that additional support a single parent or divorced parents may need, being mindful of blended families and various parenting styles of all caregivers, supporting parents in managing behaviors, especially for the sick child. Be aware of the needs of siblings who also need emotional support while maintaining consistent routines and activity schedules. Reassure parents that expressing emotions is helpful for children to see and that they can model and teach coping skills to their children with their own behavior. Support parents in using developmentally appropriate language to share medical information honestly and with sensitivity. Now, Pastor Rhonda.
Communication tips for caregivers. Caregivers are points of communication. Support the caregiver, navigate conversations across patient, the family, social network, and the medical team. Good communication supports self-expression. Caregivers help others understand their limits and needs, and understanding the limits and the needs of the patient. Caregivers may re-experience the trauma of their loved one's diagnosis when sharing news with people for the first time. Next slide, please. So how to communicate? Okay, one back, please. How to communicate as a caregiver. So here's a few tips to help caregivers communicate clearly. Respect their feelings, needs, and desires, as well as those of the patient. So we have both the mentor, the caregiver, and the patient, and both need to be respected. Speak out about their feelings while being sensitive to those of others. Try to use I statements rather than you statements. For instance, say, I need a break, instead of, you never help me. Beware of the statements like, I feel you ignore me, which says to the other person that he or she did something wrong. Instead, try, I didn't hear your answer when I mentioned such and such. Or, I need help with this problem. Focus on the present rather than bringing up old patterns of hurt. So talking with the patient. Caregivers can help the patient know that they want to be there for them and want to be included in their care. This is a scary time for both of us, but I want to be here for you to help you get through this. You're not alone. I'll do whatever I can to help you through this. I might do the wrong thing sometimes or not know what to do, but I'll do my best. We can do this together. Let's try to be open with each other and work with each other no matter what happens. It's good to set goals for the openness and the sharing rights from the start. Remind each other that you're on the same team. Share your fears and worries. Sometimes it may be hard and you'll disagree, but you might fight. But openness will help you deal with the conflict. It will only help you keep supporting each other and reduce the stress and anxiety. Acceptance and sharing will help you keep your relationship strong. Shelly?
Thank you. So let's talk a little bit more about communication strategies. A really important aspect is compassion, recognizing the suffering of others and then taking action to help. It embodies a tangible expression of love for those who are suffering. Empathy, also very important. It is the action of understanding, being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experience of another, of either the past or the present, without having the feelings, thoughts, and experience fully communicated in an objectively explicit manner. Empathy is the gateway to compassion. It is understanding how someone feels and trying to imagine how that might feel for you. It's a mode of relating. Compassion takes it further. It's the feeling what the person is feeling, holding it, accepting it, and taking some kind of action. Next slide. Communication strategies for Pastor Rhonda. This is my slide as well, correct? Or
Yes.
Okay, great. So communication strategies for difficult conversations, stressful situations, and navigating challenging times. So developing strategies for caregiving. A patient may require extended, unanticipated care. The caregiver's routine and lifestyle may shift. A patient may be non-compliant, refuse to cooperate, or follow instructions. The patient may require more medical assistance than the caregiver has knowledge to provide, and the patient may refuse help from anyone except their primary caregiver. Effective communication is an important tool in every caregiver's toolbox. Next slide. So, tips for caregivers: be proactive whenever possible. What does that mean? Communicate needs, advocate for your loved one's comfort, network, develop your resources, learn more. Knowledge is power. Ask the experts. Seek anticipatory guidance. They've probably seen this situation before and can guide you to prepare for what might be next on the horizon. Commit to growing from the experience. Benefit finding. Next slide. The goal is cooperation. It really is a team member approach between the family, caregiver, and patient, medical team, social network. And the problem is not the problem. The problem is how you handle the problem. So after all, keep your cool. Do not allow situations to cause you to blow your stack. Walk away and breathe. Remember, the problem is not the problem. I just want to repeat this again. The problem is how you handle the problem.
So patience with the patient. We have, as caregivers, it's important that we remember that the patient did not choose to be in a situation that requires someone to care for them. The caregiver mentor can assist a caregiver in gaining awareness and patience. It's challenging to be sick or unable to care for oneself. It's challenging to wait for someone else to do what you're accustomed to doing all by yourself. The patient may be at home, sometimes alone, all day, thinking about this challenge. The patient's anxiety level may increase faster than the caregiver. Next slide, please. Caregivers can establish foundation in roles, boundaries, and self-care. At the beginning, caregivers may choose to share their expected role and responsibility with the patient. Establishing a care plan and getting permission is going to be very helpful for you. A caregiver may establish who they can talk to about the patient's medical situation. There may be some limitations within the medical system. Caregivers can determine how they want to participate in the medical appointments. And does the caregiver have permission to call the doctor in the absence of the patient? And those are some very key questions and situations that we need to be aware of as a caregiver, because those roles do not come automatically. The caregiver can establish a foundation in roles, boundaries, and self-care. It is beneficial to set timelines, work hours, even if it's a family member. Times can change. Self-care, no one can care for you like you will care for you. Encourage the caregiver to take scheduled breaks out for themselves on a regular basis every day. Meditate, breathe, take breathing breaks. Did I say take breathing breaks? Take breathing breaks. Eat healthy, exercise, and sleep. And when you sleep, be sure to rest. Thank you.
Thank you so much, Pastor Rhonda and Shelley. That was wonderful. I'm going to be doing chapter 2 with Shirley. She'll be joining in a second here. I'm Shannon LaCava. I'm the Chief Clinical Officer at the Cancer Support Community in Los Angeles. And Shirley, would you like to introduce yourself?
I'm Shirley Otis Green. I'm a social worker and palliative care consultant.
Thank you. And we're going to talk to you about what does caregiving mean to an individual. Okay. So the objectives and a bit of an outline of this chapter, we're going to talk about the parts of being a caregiver, and that there's many parts. The parts that we are going to include in this presentation are about identity, a balance of benefit and burden, how one responds or reacts to situations, what part of us is inherent, what part of us is learned as we approach caregiving, and the actual meaning of caregiver to an individual. We'll also talk about additional meanings, how to be sensitive to the diversity of a caregiver's needs. We're going to talk about who supports the caregiver. We're going to talk about concentric circles, and I like to give that visual. You'll hear more. Existential considerations and anticipatory grief will be covered. This will be by Shirley with some ideas of finding balance. Okay, so we're going to unpack a little bit. So what does it mean, these parts, right? So there's an emotional and physical impact on somebody that is providing care to another person, but there's also their own identity. So if you think about who you are as a person, who you are as a relation to someone you're caring for, who you are as a member of society, there's multiple layers, there's multiple identities, and each of these are going to be impacted by taking on the role of caregiving. So the identity of a caregiver. Here we talk a little bit about the motivation. So somebody might be in the role of caregiving for multiple reasons, and it can change, and it can change in an instant, probably. So we're looking at motivations to care for a loved one out of love, out of duty, sometimes obligation, sometimes there's a feeling of guilt. Motivations can change. There's a fluidity, and I think throughout this chapter, you're going to hear us talking about that fluidity or that continuum. So all of these areas impact the identity for a caregiver. Benefit and burden. So what does that balance mean? Back to the idea of continuum. So finding balance may be difficult. It exists. From the moment that you get this news, it exists probably prior. We're all going through different balances in our life, right? And with regard to caregiving, that balance can be between what I want to and I have to. I want to provide support to this person. I want to make sure that I make the bed, and I make sure that I get dinner ready, and I want to support them, and I have this really innate need and desire to do this. But sometimes it can switch to I have to, right? And I think we've used this language ourselves probably in our daily life, like, oh, I have to do this, I have to do that, I have to do this. But sometimes when we slow down, we realize, well, we want to, right? So where is that balance? So this is part of that. It's just an awareness as we support individuals that are going through the act of caregiving for somebody, of giving some understanding to that I want to and I have to balance, so they also can take a break from some of that feeling of burden. And then also there's the awareness of one's own needs as it relates to the loved one. Those might also evolve. And throughout this project, you're going to hear about self-care. So more to come there. Very important piece. I am going to quote Pastor Rhonda of, did I remind you to stop and breathe, right? Did I tell you to take a breathing break? These are important. Okay, so reactive versus responsive. So as a caregiver, reacting quickly and impulsively in some situations might have an impact on the actual caregiver, the person doing the reactions. As an example, when we had many programs in person, and when COVID came, we had to react. We had to change everything, move all of our programs online. It was a very quick action, right? So reactive in terms of caregiving can be like, okay, now there's a diagnosis, or there's a need, or there's a sudden change, and I am going to react. I'm going to respond quickly. Sometimes that can be in haste. Sometimes that can be without thinking. It's just almost that knee-jerk reaction, as you've heard the quote, but it's quick. So the idea of a responsive approach, there's more purpose, right? It's more of a meaningful response to a situation. And that can develop over time. Sometimes people will have a natural knack at that, but sometimes that is time and experience that can be supportive in that. And situations may change and experience can grow. So the idea of inherent versus learned parts of ourselves. So I'm going to just put a guess out there that anyone who's attending this talk, or who accesses these materials, or who does the work to support somebody as a caregiver, probably has these inherent traits that we're going to talk about right now. And that's that empathy that Shelley spoke a lot about, that caring, that ability to listen, to really hear what's going on and to be supportive. And that is a natural response. Then there's a learned component, right? So as a caregiver, the caregivers also have that natural piece, and they're going to learn as they go, right? The idea of going to a medical appointment for the first time and maybe not really understanding what is being discussed, to over time, they are utilizing that same language in their discussions and sharing what's happening with their family member or their loved one. So the treatments that are happening can impact the learning. They're going to learn how to communicate, not just with the medical team, but with their own family members, right? With their own support systems. That's going to be learned. There's how they've done it, and maybe there's going to be some adaptation. Also going to recognize their own strengths and limitations. So the meaning of caregiver, and this goes a little bit on to how Pastor Rhonda and Shelley kind of started our talk, but what does it mean to be a caregiver? So it's going to be different for everyone. And as a mentor to somebody who is going through the act of caregiving, I think it's important to invite them to reflect. Sometimes we don't know, and instead of assuming, we just ask, right? So in terms of responding to a caregiver, asking somebody what it means for them and understanding where they're coming from, and it's valid, whatever they share, and anything that they reflect on is respected. And back to the parts of self, all of those elements that we talked about the fluidity, we talked about the continuum. Sometimes there's just all out conflict, and we have more than one at a time. So it's the idea of feeling love and anger simultaneously, feeling like they're caring and feeling that they're guilty, feeling they're concerned and feeling frustrated, all at the same time. So understanding that there could be some inner conflict, and that identity can shift with that as well. And finding meaning as a caregiver can also change across situations and relationships, maybe even the same relationship, because there's a sexual relationship, a financial relationship, an existential relationship, right? Spirituality can take play, the physical relationship. So there are many parts and there are many components to the relationship as well. And background matters. And so but before handing this off to Shirley, I have a few additional points here about just the diversity of our caregivers and how we can be sensitive to that. So if you look here, you're going to see a list of many different elements of diversity: race, gender identity, age. I don't think is on here. Oh, there it is at the bottom, because I'm going to touch on that. Sexual orientation, ethnicity, right? Language, SES, the social economic status, religion, maybe. There's all of these areas that are present. And if we recognize Los Angeles, and I think I can even go to my next slide here, we created this out of pretty much champions with elements of patient and caregiver support in the arena of cancer throughout Los Angeles. So we have a kind of Southern California centric focus here, and we recognize the diversity of this area as well as beyond LA. And I think in terms of supporting a caregiver, it's understanding that diversity and how that impacts the element of providing care to somebody with cancer, and understanding that not all cultures might have the same response or the ability to ask for help or the desire to communicate within the family or outside of the family. Understanding that different relationships are impacted differently. Understanding how Shelley brought in the idea of pediatric versus older adults. A pediatric patient, what does it look like for the family dealing with that? What is their culture within the family? So there's so many areas and so many aspects to be considerate of, that it's another area where we can be kind and we can just ask how that person is responding. How are they handling the idea of caregiving? We don't need to put our thoughts on them of how they should be doing it. We can listen. So we're being respectful of differences. So I primed us all with my concentric circles. So I get one last slide, Shirley, and it's my circles. So there really is this idea for me about when there is caregiving for a person living with cancer, that person is in the center, and a caregiver might be that primary support, and they're that next circle. But let's see who we can build to support that caregiver, and so on and so on. So it's almost it takes a village idea, but these are my circles. So it's how can we make sure that we can support that person that's being supported, right? And in turn, if we're in that role ever, making sure that we know that we have somebody to support us as well. So with that, I'm going to hand it over to Shirley.
Thank you so much. So if you are listening to this, again, you've had a role as a caregiver yourself, and you are acutely aware that there are no guarantees in life. And one of the things as a mentor that we're going to be asking you to do is to help to normalize this experience for others. We're going to ask you to share your wisdom and the lessons that you've learned with someone else. And one of the things that might be a helpful takeaway is this reminder that we all need to be able to tolerate ambiguity, the fact that we don't know what's coming next, and being able to be prepared, whether it's again because of things going on in life, like again, wars and disease and injuries, earthquakes and car wrecks and cancer, or again, whatever it might be in terms of economic changes that are going on, or frustrations at home or with kids. There's kind of always something, and our ability to juggle those different things and to be able to maneuver with hopefulness and optimism while dealing with the realities of whatever the challenges are that are going on around us. So we need to be able to be flexible and to be able to, again, keep our mind focused on the things that matter most. And that's going to be a really huge gift that you can offer to the person who's going through it. Because when we're the ones in the earthquake, it can be really difficult to stay focused. Next slide, please. So a cancer diagnosis changes everything, both for the person who has the diagnosis, but also again for their care partners. And whether again it's an individual who's providing physical care, or maybe it's going to be family caregivers from who are distant located, or maybe it's going to be adult children, or perhaps it's going to be our older parents. There's a whole, again, those concentric circles that Shannon was telling us about. There's a whole lot of folks that are impacted. And all of those folks are having the challenge that goes with things not being the way we had hoped, right? We all hope that when someone says that there's something going on, we hope that it's going to be benign. We hope it's going to be cured. We hope it's going to go away. If it's not that, then we hope it was a mistake. We hope that, that somebody else's slides that came in and that we really don't have cancer. We hope it's somebody else. Well, we don't hope it's somebody else, but we hope that, again, our situation is going to be resolved in the best way possible. But we know when we get a diagnosis of cancer, we've done lots of studies in this area, and a lot of folks will immediately kind of go to, uh-oh, what if this means something really, really serious? What if this really is an interruption in my life? And so the care partner is likely having those same thoughts. So the patient and the care partner may both be wondering about what this is going to mean for their future. And as the mentor to those folks, we want to be able to help people to be able to be vicarious learners and to be able to consider indeed the possibility of their mortality, and yet not be overwhelmed by that. So being able to hold both of those two things simultaneously, the hopefulness that we're going to be okay, but also the awareness that this really might change things for us in a really profound way, can be really difficult. Next slide, please. So we have this reminder that we are not in control. Again, if we could pick, we would have changed this whole scenario. So this is a reminder that things may not go as planned. We might find that, things that we were previously worried about or fearful about are now something that we have to be able to accept or tolerate or embrace, or maybe even be able to find the benefits in those experiences. So the worries about being disabled, being dependent on somebody, maybe being disfigured, and ultimately, again, maybe dying from this illness is something that the patient may be experiencing and that the care partners may be as well. Next, please. And as we struggle with those things, it invites existential questions, right? At the end of the day, what is the meaning of our life? What is our purpose? Why are we here? Why do these bad things happen to good people? How is this suffering that my family is experiencing? How is that allowed, or how is that caused? Was it something I did? Was it something somebody else did? If only, right? There can be a lot of that, either self-blame or projected blame. Well, he shouldn't have smoked. Then we wouldn't be going through this. We need to be thoughtful, if we're the mentor, to help to normalize again those concerns or fears, but also to remind us that no one brought this on themselves. This is not, there's again, in every, whatever the dramatic story is, we know that it serves no purpose to be blaming anyone. We want to be able to move forward and say, how can we cope now? Again, remember, the problem isn't the problem, it's how we handle the problem. So how do we interpret this? How are we going to be able to find meaning in this situation that we're in? And that's a really important place where the mentor can be useful, helping people to understand the concerns that they have that are underlying that initial situation. So if someone is now going to have a hospital bed, for example, in their home, what's the meaning of that? What does it mean to have care providers that are coming in, maybe paid home health aides? How does that feel in terms of privacy? What does it mean if I had been previously your lover, but now I'm changing your dressings and dealing with the wound care that you need? What does it mean if we have to take our retirement savings and use them for the costs of healthcare? What does it mean for the family to have to rearrange, that we can't do the vacations that we would have wanted, or we can't do the things that we previously had thought we'd be able to do? And how do I find meaning in that rearrangement? How am I able to, again, have that balance so that I can see the light at the end of the tunnel and the silver and the lining of the storm cloud. Next, please. So being able to think about how do we have the courage to face our own fears. Again, being able to think about the challenges that are very real. We don't want to sugarcoat this. Again, if you're a person with previous caregiving experience, you know that there can be really long days and it can be really difficult. But you also know that, again, there are some good things that can come from that. So being able to, again, hold both of those two things is going to be really important. There have been studies that have looked at this, and we know that sometimes the person who's the care provider is the more anxious person than the patient themselves. And we can call that secondary traumatic stress disorder, such fancy phrases. But what we mean by that is that there's a toll that can be taken from the person who's, again, witnessing somebody else go through something difficult. If we're providing hands-on care, the impact of that chronic caregiving can take a toll. It can be disruptive to our sleep or to our ability to take care of yourself. So that theme of self-care is something we're going to all talk about throughout this entire webinar. We know that struggling with feelings of being helpless or hopeless can feel overwhelming at times because the care partner may at times literally be bearing witness to what can seem like really difficult situations. Again, sometimes the suffering, both physically or existentially, can seem overwhelming. And so to be a partner to that takes enormous courage and requires someone to be able to tolerate those difficult feelings when we can't make them go away, make them better. Next, please. So as the caregiver is feeling these feelings, they may begin to wonder, what is my meaning or purpose, or what is the meaning and purpose of my loved one's illness? My worldview can be really challenged here. I can feel like I just don't know how to handle this, that this is so completely unfair. If you're caring for a child, for example, with cancer, it can seem like, that's such an innocent person. How could they possibly, how can I live in a world where a young person can have to go through something that's so difficult? Maybe we've been married, maybe me and my partner have been married for 150 years, and it can seem like, again, I don't deserve this. This isn't fair. This isn't right. This is the love of my life. How can this happen? So wherever we are in all of this, it can be a struggle. And as the mentor to someone who's having that struggle, it can be really important to be able to tolerate those questions. We don't have the answers, but we might be serving a really important role if we can listen to those concerns, if we can normalize that for them, if we can help them to understand that most of us who are faced with these kinds of difficulties will have questions along that line. We'll be trying to make that make sense in some way. We are sense-making creatures, and so we struggle very hard to try and make it make sense. One of the reasons this is so frightening is because if this could happen, then maybe anything could happen. And so that sense of predictability, or I have control, or I can manage things, we might feel like we're at the end of our rope. And if I can't manage this, who knows what tomorrow's going to bring? So we might feel, again, overwhelmed. Next, please. So it's really important for us, if we're in that circumstance where things seem like they're kind of escalating out of control, that we have a moment to, again, remind the caregiver that life is still of worth, right? And that we want to live our lives with awareness. Perhaps one of the gifts of mortality is the awareness that we can't take things for granted, that we want to ensure that we minimize regret wherever possible, and that we want to normalize the fact that we are where we are in this life scheme, and that it's important for us to be able to both grieve the things that are lost, but to also be able to hold value for the things that we still have. And there's a lot of grief. So we have a whole slide here that reminds us that there can be the loss of dreams, the loss of the person's health, the loss of plans for the future, the loss of, again, our sense that the world is fair and that things are going to work out. There might be losses that the caregiver is feeling in terms of of, again, their hopes, but also the losses that the patient is feeling in terms of function and quality of life. There might be concerns about the impact that this is having on their family or their extended network. So again, a lot of folks will have, maybe it'll be a parent that is going through the cancer experience and the partner is their care provider. And they're both grieving the fact that their children are not able to have the kind of quote normal childhood that they had hoped that they could provide. And they might be worried about the impact that that has. And again, as you keep hearing us mention, we're aware that this is more than just a physical thing that happens to people. Cancers is something that has financial implications and social and sexual and spiritual implications that are, again, far beyond what might have been originally anticipated. There can be these unexpected areas that need to be grieved and appreciated as losses that are very real. And we know that losses are, what word do I want to use? That they are compounded, right? So if I have a new loss, it not only is the loss of that experience, but it also can re-trigger for me previous losses. And so we need to be very thoughtful about that as well. So again, new griefs can be re-triggered. Next, please. So thinking about all of this reminds us again, as the mentor, to remind the caregiver of the need for balance. And again, part of what we've mentioned is that we want to keep striving back to the importance of self-care, and that we need to be caring for ourselves in all of these different dimensions. We want to make sure that we encourage people to take good care of themselves while they're taking good care of others. Next, please. And so as folks are doing that, we want to be thoughtful about how do we keep talking about balance, how do we both honor the very real losses that are going through, the very real challenges that are faced with someone with cancer, and still being able to find the rewards that are there. And I really love this list because there are things that are absolutely powerful and wonderful about the caregiving experience. Being able to see the personal growth that you have, being able to appreciate the courage that you've demonstrated by being a caregiver and confronting these difficult things that maybe in the past you didn't think you were strong enough to be able to do. Many people will report increased intimacy, that they've never felt closer to their loved one, that they've never had a chance to reflect as deeply and as honestly in regard to how they really feel about the purpose and meaning and quality of life. Next, please. So as folks are struggling with all of these things, it's important for us to circle back. Again, we like circles, there's a theme here, and ask what's the most important thing going on right now. So as a mentor, that can be something that you come back to over and over, helping that care partner be able to focus on what matters most at this point in time. And that moves us to the next section, I believe.
Yeah. Thank you, Shirley, and we will hand this off.
So thanks, Shirley. And you actually set up with, I was listening, one of the next section, which was how to normalize the cancer experience. And you briefly mentioned that in yours. So I'm going to let our three presenters introduce themselves and then take it away. Go ahead, guys.
Yeah, thank you so much. So I'm Jessica Ernest, joined by Andrea Danner and Jennifer Drew. We're social workers with Cedars-Sinai Cancer Patient Family Support Program. Jennifer practicing at the Angeles Clinic, and Andrea and myself practicing at Tower Hematology Oncology. Next slide, please. So we're going to provide a snapshot of cancer caregiving and who makes up this supportive and resilient community, as well as the diverse roles of a caregiver. We'll also overview the many shared reasons and motivations behind becoming a cancer caregiver, and also highlight the potential impacts of caregiving. And lastly, we'll identify some risk and protective factors of caregiver distress, hopefully sparking some thoughts on how to navigate the challenges and rewards of cancer caregiving. Next slide, please. Caregiving is essential to effective cancer care and management, especially since most of treatment is in an outpatient setting. So the caregiver can act as a bridge of communication between the care team and loved one, providing critical insight. So in addition to communication, there are a variety of support tasks one may take on, including in the physical, spiritual, and emotional aspects of life. Next slide, please. The National Cancer Institute performed a study that gives a glimpse into who provides the role of informal caregiving, as well as some common aspects of caregiving within cancer care. As you can see, this role is most commonly performed by family members and women who largely assist with medical tasks in the home. We'll go into more detail on this strain caregiving can place on finances, employment, and emotional health. But most importantly, this study highlights that these are common experiences and stressors to the cancer caregiver. Next slide, please. Again, these numbers highlighting that caregivers often are employed family members providing necessary medical assistance. Next slide, please. The role of a caregiver is multidimensional and can touch on all aspects of daily life. And here are some examples. So the caregiver doesn't need to expect what their role is going to be. You can ask your care team for their insight on what to expect your loved one's care needs to be, and including the cancer patient in that conversation and providing them an opportunity to identify their needs while the caregiver is able to listen before assuming what the role is. And caregivers are not alone in this role, much like Shannon referenced in her circles of support. Identify your strengths and what tasks can be delegated to others in your support network or even a hired professional. It truly does take a village, so identify and utilize your support systems. Also keep in mind the caregiver's role and loved one's needs can change throughout the cancer experience, so expect change and adapt accordingly. Next slide, please. If you do not live locally, you can still provide caregiving to a loved one from afar. So long distance caregiving tasks can include taking an active role in communication with the care team, organizing and storing all essential documents, interviewing hired assistants, creating a care calendar, and being available for emotional support. And this can be a challenging aspect of caregiving, but it's definitely not impossible. Next slide, please. So while the reason for becoming a caregiver is primarily voluntary, one may also experience feelings of guilt or obligation, which is normal. There are many potential reasons behind becoming a caregiver after a loved one is diagnosed with cancer, including family obligation, lack of financial means to hire professionals, limited support network, much of what we talked about in previous chapters, but as well as a sense of loyalty and innate ability or passion for caring for others. It's okay if a caregiver doesn't immediately identify as a caregiver. It's a role that is unexpected at a time you may be in shock by the cancer diagnosis, and it may take time to adapt to the idea of becoming a caregiver. Next slide, please. What if you feel unprepared or don't want to be a caregiver? I mean, these are very important points to keep in mind. It is normal to feel overwhelmed and burdened or even trapped. There's no single right way to be a caregiver. It's not easy, and there will be times when you want to give up, and this is normal. And every situation, patient, and family is different, and most caregivers experience changes throughout the cancer experience. Next slide, please. Now, Andrea is going to take us through the potential impacts of caregiving, which include family and social life, work and finances, and physical and emotional health. Next slide, please.
Caring for a person with cancer often brings families together, with members supporting one another. However, the pressures of cancer and caregiving may also reignite old family conflicts or create new ones. These conflicts can make it difficult for family members to work together. Next slide. Cancer causes changes in communities, friendships, and as well as the family's identities, roles, and daily functioning. Regardless of the relationship, individuals are learning how to support each other, deal with changes in intimacy, the division of their time, managing daily life and responsibilities, and more. While facing difficult times together has been shown to strengthen relationships, staying close through stressful times requires open communication, patience, and understanding. Maintaining a usual schedule can be both comforting but difficult. So the reminder to the caregivers to just do what they can, and then it's okay to ask for help. Next slide. Caregiving often feels like an additional full-time job on top of employment. Specific types of employment, like hourly, temps, and self-employment, may experience a larger negative impact. Individuals may also feel that they need to turn down opportunities, work fewer hours, or possibly even retire in order to maintain their caregiving responsibilities. A household may be at a higher risk for financial distress as well if the individual going through treatment is the main primary earner. Regardless of the situation, it's important to remind individuals to review their legal protections and employment benefits, which you guys will get to hear more about later. Next slide. Patients and caregivers often face nearly identical career challenges and sacrifices throughout treatment, as well as in survivorship. Caregivers are just as likely to miss work, have to take days off without pay, leave early from work for appointments or caregiving responsibilities, and work fewer hours on average. Nearly half of all caregivers polled admitted that the additional caregiving responsibilities had some impact on their work, and 28% reported a major impact. Next slide. Cancer treatment also comes with a lot of expected as well as unexpected costs, even when there is health insurance. There's a lot of indirect costs associated with treatment that families haven't quite thought about, such as transportation, gas, the different upkeep on cars, finding housing closer to the treatment center, home health care, aids in the home, rehab centers, childcare, supplies, medications, many different things that come up. And then these additional costs combined with the potential loss in income can have a significant financial impact on the family unit. Next slide. Caregivers also experience an impact on their physical and emotional health. Caregivers may put the needs of their loved one first, allowing their own physical and emotional health to deteriorate while striving to improve and maintain the health of their loved one, which can create some caregiver distress. Caregiver burden is caused when there's an imbalance of care demands relative to the time and resources of that caregiver. Having a high caregiver burden can be related to some high-risk health behaviors like smoking, having less time for exercise, inadequate sleep, taking prescription medications not at the correct times as well. Next slide. The theory of role strain teaches us that having a large number of social roles is associated with an increased stress and burden. These roles are kind of in competition with each other and for the caregiver's physical and emotional resources. The more social roles that a caregiver performs, the more likely the caregiver is to experience stress and negative affect. Next slide. For caregivers, neglecting your own care can lead to a lowered immune system functioning, fatigue, increased blood pressure, headaches, insomnia, backaches, GI upsets, cardiovascular problems, and much more. Next slide. Caregivers are also at a higher risk for anxiety, depression, fatigue, reduced self-esteem, and somatic health problems. A quote from a caregiver stated, "Sometimes I feel as though my whole life revolves around his illness and I don't matter except to care for him." Too often, caregivers feel as though they don't have an outlet. This leads to the suppression of emotions, building up of resentment. It's important for caregivers to know they're not alone. And then a poll showed that 76% of cancer caregivers say they've personally experienced distress throughout their caregiver experience. Next slide. And as Shirley just previously mentioned, grief does not come with just the loss of life. Grief is experienced with the loss of health, dreams, future, the befores and afters, many different things. As much as we may wish, there's really no guide to grief, and there's also not a linear way to navigate through the process. Many individuals experience a variety of different emotions. They jump back and forth between these emotions. It can be really helpful to acknowledge the pain, understand that the grieving process is going to be unique to every single individual, and to ask for help and take care of themselves. Next slide, and I'm going to pass it over to Jen. Jen, you're still muted.
Thank you. As my team has shared and as our co-presenters have shared, that there's a myriad of impact on the caregiver from the diagnosis of cancer in the family. The impact can be physical, mental, emotional, and spiritual exhaustion, also known as caregiver burnout. And some of the burnout can include becoming ill oneself with cold or flus as the immune system is less strong, feeling exhaustion, resentment, depression, anxiety, and certainly feeling overwhelmed among others. Next slide. It's very valid and very normal to feel a sense of burnout at different times during the treatment, especially if your loved one has an extensive pathway through their cancer experience. There are factors that can contribute to higher rates of distress. These can include lack of financial resources, lack of social support or connection with either a group of family or friends who can help take on some of the caregiver burden, gender roles and responsibilities as parents or responsibilities as taking care of your own parents can contribute to higher distress among caregivers. Cultural views can in fact influence caregiver distress in certain communities that might distrust the medical establishment. There might be higher rates of caregiver burnout, and in other groups that are known to give more hours to caregiving, there can be a higher rate of depression. Next slide. There can also be positive impacts of caregiving. There can be meaning and purpose, as other folks have spoken about, meaning and purpose in giving care to an individual, whether or not they have a terminal cancer or whether or not they have a curable cancer. It's important to realize that there can be many, many positive impacts around being part of the treatment team. There can be spiritual growth, increases in empathy, learning about strengths, and deepening relationships and bonds at all levels of the family and the supportive community. Next slide. So there are some protective factors that can prevent or alleviate caregivers' distress. That can be a strong spiritual orientation, doesn't have to be organized religion, but that can help as well when there's strong community and social support. There can be a willingness to use social supports and resources, which is not equal across all cultural groups. There's also adaptability, resilience, strong family bonds and foundations, and limited life stressors outside of the cancer and caregiving role. Next slide. So there are strategies that can increase the satisfaction of caregivers. Things that are important include to share the hopes, their dreams, and their fears. Existential concerns are important to be spoken of, not to be swept under the rug. And in some cultures, it's not appropriate to discuss existential concerns with the patient, let alone within the family. Surrounding yourself with family, friends, pets, enjoying music, creating an increased support group, whether that's attending support group sessions through various organizations in the community like Cancer Support Network and other providers. reconnecting with lost traditions, perhaps doing life reviews and legacy events, and celebrating something in each day that gives hope to the patient and caregiver. Next slide. So coping as a caregiver, I think each of us have spoken to in each of the chapters we've presented self-care. And in a nutshell, self-care is putting on your oxygen mask first so that you can care for the patient and for the others in your family. So taking care of yourself contributes to improved mental, physical, spiritual health. Emotional health is something to ask for help around. If you're experiencing symptoms of anxiety or depression, there are resources that can provide therapeutic support. Exercise is important, and finding something that gives your life meaning and purpose in each day, and taking regular breaks like the breathing break that Pastor Rhonda alluded to, and taking time to have cancer-free time, for example. There's a certain time each day when you talk about yourselves, and that doesn't have to include just treatment and diagnosis. So set realistic goals and set healthy boundaries, and those can be some of the attributes of a healthy caregiving relationship. Thank you.
All right, good evening. My name is Marlon Seria. I am the Director for Clinical Education at Providence St. John's in Santa Monica. And the next couple of slides are the presentation from Dr. Melanie Goldfarb and myself. Jen kind of stole my thunder a little bit because I was going to say that much of what you have heard up to this point were about self-care, taking care of yourself. But I know that as caregivers, for those of you who are attending this webinar tonight, you have had a lot of questions about cancer and about how to take care of your significant other or your loved one. So my role is a director for clinical education. I am also a nurse scientist, but the most important role that I have is, and that's related to what we're doing tonight, is I have been a cancer nurse since 1998. And I have had all these questions both from patients and the caregivers themselves. As caregivers, you did not apply for the job. You know, you kind of got the job on the spot without any interviews, without any application forms. And it's sometimes very difficult and distressing to try to learn your role as a caregiver while helping the patient or significant other that you are caring for. Next slide, please. I have a lofty goal. I only have 15 minutes and I got messages. I am still getting messages from Dr. Goldfarb to try to speed it up so that we could catch up on time. But you could see that the goal is lofty here. This presentation has been, I have actually done this presentation many times, but it has taken me 4 to 6 hours to go through this. And we have about under 15 minutes now to cover all these. So whatever details that I may not be able to share with you, we have resources at the end, and also the team, I'm sure, will be available after this webinar if you have other questions for us, and we'll be happy to answer those questions if we're not able to cover any of the topics that you are here for. Next slide, please. So this, I think, is a very important slide, and I will go through this more than the other slides that will be coming up. And the reason for that is these are the stages that you will see. I call it the trajectory of care. I used to call it a journey, but you know, cancer is not really a journey, and no one decided to be on that journey. So this is a trajectory of care for most of our cancer patients. Pre-vivorship is a stage where, you know, we can actually prevent cancer by healthy lifestyle and some interventions that includes vaccines. So vaccines are not just for COVID. You have heard about the HPV vaccine that can help prevent cervical and rectal cancer. So those are some of the interventions that will help prevent cancer. Under pre-vivorship, there also is early detection, and those are the screening tools and methodologies that will help detect cancer if we have it early in the phase. And the earlier we catch cancer, the better the outcomes will be. The interventions under the different phases here, pre-vivorship, survivorship, and then long-term survivorship are all different. And the a healthcare environment where you may get the care for each of these phases will also be different. Pre-vivorship usually happens in the community or with primary care. Survivorship happens at the point of diagnosis. Usually a symptom will bring you to your primary care physician. It gets worked up, and to cut the long story short, eventually will lead to a diagnosis of cancer. And that diagnosis will lead to treatment. Once you're getting treated, you will have the patient or the patient will have the symptoms related to cancer, or the cancer itself, some of the issues that we have with cancer. And so that's where secondary prevention happens. And that means the healthcare team is trying to prevent those symptoms, or trying to limit the symptoms that you have so that you could keep getting, the patient can keep getting the treatment. That is also the phase where we monitor for recurrence. And then for patients who have gone through survivorship and are in remission for some periods of time, usually I hear 5 years, 1 year, 5-year remission. That brings them to the long-term survivorship phase, where the healthcare team looks at management of recurrent disease, and for some patients, end-of-life care. Next slide, please. In terms of cancer itself, you see we have multiple topics here that we will be covering very briefly. Understanding cancer, what are the causes, and how do we prevent cancer from occurring? What are the screening recommendations for cancer diagnosis and staging? What are the symptoms that will prompt a patient to show up at a primary care provider's office for treatment? And then what are the different cancer treatments, and for advanced cancer, choices for care, coping with your feelings, planning for advanced cancer and caregiver issues related to advanced cancer. Next slide, please. So how's cancer diagnosed? The most important thing that I want to share here is, yes, we do have imaging tests. We could take CT scans and x-rays, but the most important thing in diagnosing cancer is the pathology. And the pathology is if you have a liquid tumor, so leukemias, or if you have a solid tumor, we look at those cells under the microscope, and depending on what the cells look like and how aggressive the cells look like, that will determine the cancer diagnosis. Any imaging, any masses that they may see on MRI or nuclear scan or bone scan or CT scan test, that is not cancer until after pathology has been done and has been reviewed. Next slide, please. So cancer is a collection of related diseases. This is a very difficult concept to grasp. Not all cancers are the same. In fact, even within a single tumor, you have multiple cells in a single tumor because of mutation. And mutation is a very important topic right now, especially with COVID. We have the gamma variant and the delta variant. So think of that when you think of cancer. Cancer cells mutate, and even within a single tumor, there are multiple mutations of the cell within a single tumor. There's differences between cancer cells and normal cells, and the main difference is cancer cells basically will ignore all the normal processes that our normal cells go through. So they will grow continuously, and it will not follow the same process where cells die. Drivers of cancer, those are some of the risk factors. Cancer spreading is another issue that we have through the bloodstream, where cancer cells break off from the main tumor and starts to metastasize to the other parts of the body and other organs. And there are many different types of cancer. There are also tissue changes that are not cancer. That's the reason why I said earlier that when you look at an MRI or a CT scan, that you might see some cell growth, but that's not necessarily cancer until biopsy proves otherwise. Next slide, please. Cancer disparities. I think it was Shirley who mentioned this earlier, maybe Shannon, when she was talking about diversity and then how certain groups have disadvantages and how outcomes are poorer in certain groups. So we could look at race and ethnicity, gender identity, geographic location, income, education, age, all those factors, all those variables can impact your cancer outcomes. It becomes even more so important this time, especially with what happened last year with some of the racial issues that our nation has seen. And that has definitely affected us in healthcare and how we look at all these things and how they impact the treatments that patients are receiving. Next slide, please. In terms of risk factors, we know that it's not usually possible to know exactly why one person develops cancer and another doesn't. I'm sure you have seen patients where they have all the risk factors and they are cancer free, and then you have a patient who has followed all the rules and has developed cancer. But we do know that there are risk factors that may increase your chances of developing cancer. What I wanted to talk more about are some of the protective risk factors that can help prevent cancer. Some of those, the most classic ones that have been discussed are for ovarian cancer. Those who have children are usually protected from ovarian cancer, and those who have had children earlier in life have more protective factors against ovarian cancer. That is just one example. Breastfeeding is another, but there are not just risk factors, but there are protective factors that have been studied and published in terms of for protecting us for cancer. Next slide, please. In terms of the genetics of cancer, I will use the example that I used earlier with COVID and the different variants. So all cancer is genetic. You may not have had a genetic predisposition to cancer, but once a cell mutates, then that starts the genetic process of cancer within each of us. So that is very similar to COVID, where now we have multiple variants of COVID. And because cancer mutates, the cancer cell mutates, the treatment will be very different as well. This is one of the reasons why a patient who was initially diagnosed with cancer may respond initially to a treatment, and then 6 months later, the response will start to slow down, and we have to switch them to another treatment. That's because the cancer has mutated, and the cells that has mutated are not responding to the previous treatment anymore. Next slide, please. Symptoms of cancer, if you have not heard, this has been taught in school. I've heard the word caution, C-A-U-T-I-O-N, as early as high school. And those are the most common symptoms for cancer. Change in bowel or bladder habits, sore that does not heal, unusual bleeding or discharge, thickening or lump in the breast or elsewhere, indigestion or difficulty swallowing, obvious change in water moles, and nagging cough or hoarseness. You don't need to remember all of that. What I tell my patients is that you know your body better than any of us, than any of your family members. And if there is something that is not normal at all, not part of your normal routine, then it's best to get it checked and get treated as early as possible. Next slide, please. It is very important that we stage the cancer. Again, because of cancer mutation, there are many different treatments for the different stages of cancer, not just for the different cancer sites. So a stage 1 cancer will be treated very differently from a stage 3 cancer. So it is really important for the oncologist to stage your cancer to be able to determine the treatment that will be more appropriate for you. The next slide, please. And some of the cancer treatments, surgery is the oldest known treatment for cancer. Many of us are familiar with chemotherapy and radiation therapy. Immunotherapy very recently is in the news, all over the news, particularly for melanoma and renal cell carcinoma. It has significantly improved outcomes in the past couple of years. Targeted therapy and hormone therapy are some of the treatments that we use as well. The next slide, please. We know that cancer treatments and cancer itself can cause side effects. So it is very important to discuss the side effects with your physicians. As caregivers, it is very important for you to ask the patient that you're taking care of about the side effects of cancer treatment. Many of the patients are reluctant to talk about side effects because they think that if they report side effects, then we will take the treatment away from them. But it is very important for them to know that we do have interventions that can help prevent or treat the side effects. So it is very important to bring up the side effects when you go to your provider for your regular appointments. Next slide, please. And I'll just introduce the questions to ask your physician. Dr. Melanie Goldfarb will take this next couple of slides.
Thanks, Marlon. So I'm going to do these quickly because I really want our last group to have a good chance to present. And I want to remind our presenters, you know, we set this up so you guys could use all our presentation as resources, because you guys are going to be the one that are going to be teaching the caregiver. So please all use this. So just in brief, how do you talk about, if you want to go back, the clinical trials? So they are research studies. They're not using people as guinea pigs. Not all of them are invasive. Many times trials are only for more advanced cancers because we've kind of figured out the treatment for some of the early stage cancers, but that's not always so. Sometimes we're trying a different order or different combination of treatments, or how much treatment do we need? And those, we don't just want to do things randomly. We really want to study it so we can have some good data to make any changes. We provided a website below that can talk a little bit more about clinical trials. Next slide. And lastly, complementary and alternative medicine. So I'm a surgeon, I take care of cancer patients, and I also do a lot of research and spend a lot of time in cancer survivorship. And one of the big things that many more physicians have come to embrace over the years is complementary and alternative medicine. Not as an alternative to Western medicine to treat your cancer, but as complementary to all the treatment you're getting. And so I think that it's important to let patients know that it's not only okay, but it's even more so than that, probably a little advocated to do some complementary stuff on the side. And it can really help patients cope with a lot of side effects, worry, comfort, and many other aspects. Next slide. And I think that we have the last one. We can skip that because I basically said that already.
Oh,
And
Melanie, I just wanted to
yeah.
say one other thing. We skipped the slide on questions to ask your providers. So, you know, we ask a lot of questions when we're buying a house. We ask a lot of questions when we're buying a car. Please ask a lot of questions when it's your life or the patient's life on the line. Make sure you go back to that slide, list those questions down, and when you go to your appointment, ask the physician. Even if you only have a 15-minute appointment, a 15-minute in that clinical exam room, make sure you ask the questions, because this is your life or the patient's life that we're talking about.
Thanks, Marlon. And most clinicians these days, whether it's them or their team, will be available for to do that through as much time as you need. So encourage your caregivers to actually go with their patient to appointments so they can be there as a second person to help ask a lot of questions. All right. Lastly, support and resources. We're going to go a little bit over and then have time for question and answers. We apologize, but I really want Liesl to be able to do her thing because she's amazing. So, Liesl, you can introduce yourself.
Hi, can you see me now?
We
My
can.
name, hi, my name is Liesl Schweers. I'm a clinical social worker. I'm at Children's Hospital Los Angeles, and I work in the long-term survivorship follow-up clinic. So we see survivors that are at least about 2 years off treatment into young adulthood. So I'm going to quickly go over some resources which you absolutely will have access to in this slide. In this slide deck. So pardon my brevity, but really if all else, you can go to your cancer center, speak with the social worker if there is one dedicated to your program, talk to a nurse care manager, patient navigators, bedside nurses, physicians. We have done a lot of the hard work and the heavy lifting of vetting resources and information. You know, you can Google just about anything today to get information and get help. But really, you know, working with your resource center or the staff at your cancer center is the best way to get really you know, timely, correct information about resources, patient medical information, as well as online support. Most of the cancer support centers and resource programs also offer direct services at the site. And these are generally family centered. You know, family is a cancer diagnosis. So when there are resources available, they are generally available for the patient, for the direct caregivers, for the siblings, for the extended family. So if you're not introduced to these activities, ask about support groups, ask about art classes, or ask about pet therapy. In dealing with the financial and legal strain of cancer care and cancer treatment and survivorship, there are plenty of resources, and just ask, and you should be given a wide variety of resources at your home institution. Next slide, please. One of the most amazing resources is indeed the cancer support community. There are 4 locations in the greater LA area, and there are Gilda's clubs that have joined with the cancer support community. You can find resources all over the country, and there are even some international sites. And you know, our West LA location is absolutely amazing with the diverse programming for patients and caregivers, on treatment patients, off treatment patients. And now one of the blessings of COVID is that we've all gotten very familiar with accessing support and resources virtually. So lots of activities available just from your living room. So no need to get tangled up in all the LA traffic to get the support that you need these days. Next slide. There are many resources in this deck, but these are just a few. These resources on the first slide are really about connecting caregivers with one another to share experiences, to hear stories, and to get insights into ways to cope. Cancer care is another one that's not on here. I'm wondering if we could add it, but again, the social support for caregivers are in the form of classes and support groups, as well as mentoring and peer-to-peer support that are available through these wonderful resources listed here. Embracing Cares is an international movement really dedicated to promoting and recognizing the importance of absolutely training and providing guidance for caregivers to help them be the best that they can be. The Garrison Institute has a wonderful program of mindfulness just for caregivers. And I just looked at the site earlier today, and they have a new app that you can download on your phone, and you can do mindful meditations throughout the day to really sort of shift down a little bit, find some space for mindfulness and wellness check-ins for yourself. Lots of helping hands and meal trains are great resources where you can post what you need on a secure website, and friends and family can log on and sign up to bring you dinner, sign up to pick the kids up from school, help with transportation, a lot of sharing the load through those resources. Again, Triage Cancer, another great website, and they have a stress management survey that you can take to really gauge your sense of being overwhelmed or burnout, and great tools for mitigating that stress on Triage Cancer as well. Next. Briefly, I mentioned this already, but there are websites to actually help caregivers mentor each other, learn from one another, and these are just a few of those examples listed here. Next slide. Financial and legal planning. This is a big, important issue that nobody really likes to talk about, and it's really kind of a shame that we have to worry so much about these things when we're dealing with life and death situations of our loved ones. But it's so important to really try to get organized in the beginning, and maybe there's a friend, a neighbor, a family member that's really good at bookkeeping that can help you digitize records and stay organized. There are lots of online tools to track expenses, to even track appointments, to write down those questions when you go to the doctor that Marlon said was so important, really just to stay organized using electronic means. Again, just really not being afraid to ask for help for folks that are a little more experienced and capable of helping you with the financial and legal stuff. People want to help, you just need to help them by showing them how. Next slide, please. These are wonderful legal resources. Advanced care plans, advanced directives are something that we should all have regardless of a cancer diagnosis. This is something you do when you're well, so that in the event that you can't express your wishes or end of life medical care that you would like. Aging with Dignity has a 5 Wishes booklet. There are many other organizations with online sites that provide advanced directive tools. These are other advocacy agencies where lots of resources are listed for getting organized both financially and legally. Next slide. In California, we're very lucky to have paid family leave as a benefit. Not all states do. It's not a lot, but it's something when someone has to take time away to care for a family member. We also have Family Medical Leave Act in the US. So many employees are eligible to take unpaid time up to 12 weeks a year currently to care for someone who's ill. And that can be taken in big chunks or on a daily, day by day basis or week basis. So FMLA, paid family leave, are absolutely available to folks living in California. Next slide. And there you go, paid family leave. There's an application. And this is where the nurse care managers, social workers, staff at the hospital or clinic, doctor's office can help you fill out those forms and navigate through filling out those applications to get those benefits going. Next slide. Again, Triage Cancer has lots of resources, and they have videos and little PDFs of guides that you can download to really explain the FMLA and the paid family leave. And I would also mention that the Cancer Legal Resource Center, in addition to Triage Cancer, those are great agencies to contact to get guidance around all the medical, the financial and legal aspects to caring for someone with cancer. Next slide. Just more resources. We have a lot of information here, too much to go over, but the links should all be good. They're hot links. And again, also of note, anyone diagnosed with cancer is protected by the Americans with Disability Acts. Lots of protections there for job, access to education, young adults, absolutely. We encourage our patients at least to try to continue with work as possible, try to stay in school if you can, but knowing that there are supports available to provide accommodations, extra time for things like exams and assignments, access, meaning physical access, wheelchair ramps, that sort of thing. So again, the ADA is a good protection for patients and survivors. Next slide. These are a graphic of a few more advanced care planning resources. Again, this is something we should all do before we get sick, just to be prepared and not have to make those difficult decisions in the middle of a crisis. So beautiful resources compiled there. And I think there's one more slide. These are some disease specific websites. And again, this is one thing I didn't mention, but depending on the type of cancer you have, there is probably going to be a website, an organization, a society, association that has done all the vetting of those resources. So information for caregivers as well, whether you're caring for a child, adolescent, adult, or someone who's elderly. Lots of disease specific support resources available for caregivers. Next slide. Again, reminding you that Triage Cancer has wonderful videos. They have great videos on understanding insurance, describing the difference between an HMO and a PPO, what's a copay, what's a deductible, all that alphabet soup that gets really, really, really dizzying and crazy making. Triage Cancer has broken these concepts down. And again, these can be shared with caregivers, all the caregivers in the support constellation, to help everyone understand how to get through this. Next slide. These are just some references for further reading. And next slide is the end. And these are some books that I think everyone on the panel has suggested to really just, help to normalize and recognize that the experience of living with illness, living with cancer, sometimes approaching end of life, these are things that we should absolutely find ways to understand and to support one another with. And these are some great titles to use during this journey, this cancer journey. And with that, I think I will end. Thank you.
Awesome. Thank you, Liesl. Thank you, everybody who's still on, for staying on time. We apologize for going a little over. I want to again thank Tower Cancer Research Foundation for giving us the ability to be able to put this together for you. So a huge shout out to them. And I think everybody, all our panelists are such a wealth of knowledge. And this is really for you on the call or on the webinar to be able to help caregivers or potential caregivers that come to you with, how do I do this? And now hopefully you'll have a set of resources and some more knowledge to be able to do that. So with that, if there are any questions, Shannon's going to moderate. And please, either in the chat box or you can, I think, verbalize them if that works. Otherwise, chat box is good.
Yes, so I would like to invite all of our presenters to come back on video. If you're still here, please join us. And if there are any questions, there is a Q&A function that you can throw your question in and we can get to it. And I do want to just be very gracious to each of you for joining us today. And we do have a question about access to these slides. So absolutely, to share a little bit about not just these slides, but the whole function of the Los Angeles Cancer Caregiver Consortium. You've heard us say LA3C several times today. So we came together over the last year to compile all this information, put it together in this slide deck, but we're going to be creating written materials that will be disseminated. This video will be disseminated, and the slides will be available. And more than anything, we don't want to hold on to it, we want to share it. So we will even be reaching out to all of you that attended to see, get feedback from this talk today, and also ask, maybe you have ideas of where we can disseminate this information. So this was meant to be shared. So absolutely, if you're here, you will have access to everything that you saw today. There we go. And there is a question about, is there a better word for caregiver? It sounds like a pencil sharpener. Would be support person be better? Other ideas? Such a good question. And this is something that we actually discussed prior to putting all of this together. And we were kind of like settled on the name of LA3C, but I'll let the panelists answer some of the wonderful ideas. Shirley, I'm going to point you out because I really like what you kind of came in with Care Partner, but please share your thoughts on that.
Right. I think sometimes the word caregiver implies that a person is doing physical care. A lot of the people, when I worked in oncology, would feel like, well, I'm not really a caregiver yet, and so there was some hesitance to accepting that term. But the literature, if you use caregiver, if you do a search term for Google things or some of the resources, it's a pretty common term. But care partner is something that a lot of the cancer patients that I've worked with have felt resonated more comfortably for them, and especially in the earlier stages, or if they're remote and not doing, again, the day-to-day physical stuff, they might feel that care partner is more descriptive. I think, as your question implies, the idea of what we're really talking about is somebody who cares for and supports someone who's going through a difficult experience. And we are absolutely open to better words. So thank you for your comment.
Yes, thank you. And I believe we have time for one more question if there are any other questions. I actually, from this point, to give you your evening back and to make this a shorter video for those of you that are going to be accessing this later, I just really want to extend a big shout out to Melanie and Marlon from Providence St. John's for putting this together, for all of our panelists here for creating this content, for all of our LA3C members, and a big thank you to Tower Cancer Research Foundation for funding this project. And I cannot wait to get this far and wide. So thank you all for attending, and thank you all for being here tonight, and for those of you attend in the future. So
Thanks, Shannon. Huge shout out to you as well for organizing.
yes, thank you. My pleasure.
All right. Thanks, everybody.
Have a great evening.
Bye.